And in today's class, we are going to discuss about one interesting topic, that is brain stimulation treatment. So this is something which is related to the therapeutic equipment. Since our subject is diagnostic and therapeutic equipment, here we will be discussing more about diagnostic related equipments and therapeutic related equipments. But in this class, we are going to focus on one kind of therapeutic related equipment, that is brain stimulation treatment. Okay, so in the name itself, you come to understand what it's all about. Here we are going to stimulate the brain by means of some stimulation. Okay, so in this way we are going to treat or regulate the brain activity. That is the one line definition of a brain stimulation treatment. Let's see the deep about what is brain stimulation therapies. Okay, so this particular brain stimulation therapies plays a very important role, especially when you want to treat any mental disorders. Okay, so if you speak about mental disorder, means that is like you can either take epilepsy, that is seizure, or some people will have mood swing problem, and some people will have a OCD. Okay, the obsession convulsive type of problem. So this type of problem is something related to our cognitive skills. Okay, so if you have problem which related to this thing, then we have to go with this type of treatment, that is brain stimulation treatment. Okay, so this particular treatment is mainly involved in treating the mental related disorders. So the main aim of this treatment is that here we are going to give the stimulus in order to activate or inhibit the certain brain cells, because we know that the brain cells that is a neuron which is highly responsible for all our activity of our body, right? Either it is related to organ, or either it is related to mental kind of things, or even our behavior, emotional, everything. We have the influence of brain activity, right? So based on our severe problems, based on our severity of level, we can either activate that particular cells or inhibiting the particular cells activity in order to regularize the problem, in order to regularize the normal brain activity. Okay, that is the main thing of brain stimulation therapy is all about. So and also we know that now we are going to give stimulation to that brain. So we can take any form of signals in order to give stimulation. Either we can go with electrical signals or magnetic signals, or combination of these two. Okay, so by sending this kind of stimulation to the brain, we are either activating, that is either we are triggering or inhibiting that particular brain activity. That way we are having some improvise or enhancing the mental health problems. Okay, so this is the main overall objective of brain stimulation therapies. It's all about. Okay, so now we will see what are the different types of brain stimulation therapy. Okay, the based upon like what type of signal, what type of stimulation we are giving, that also the one consideration. We can take it as a types, and also we can have the area or the position where you are giving the stimulation. That also we have types in related to that also. Okay, so if you take there are different types of brain stimulation therapy. One is electroconvulsive therapy, second one is repetitive transcranial magnetic stimulation, and third one is vagus nerve stimulation. Fourth one is magnetic seizure therapy, and last one is deep brain stimulation. So these are the four major classification of brain stimulation. In next we will see one by one in detail. So first we will take electroconvulsive therapy. Okay, so this is a particular therapy we can also name as ECT. So this therapy is a one kind of brain stimulation treatment, or you can also say neuromodulation treatment. So here we are using some electric current. Okay, because the name itself, you can have the word electro, right? So the electro means electric current. Okay, anyway here we are going to use some electric current in order to stimulate the brain cells. So that is the thing we are going to do here. So here in this process, this is a one kind of non-invasive procedure. Here we will be sending the electrical signal from outside in order to stimulate the particular brain cells. That way we are inducing the seizure activity for short span of time. So the thing why we are inducing seizure in the sense, by doing that we will equalize or normalize the mental behavior changes. That is the main motto of here. So just by inducing the seizure activity, by stimulating the specific brain cells, we are regularizing the normal brain activity. Okay. The reason when we have to go with this particular ECT in the sense, when the people have some mental disorder, okay, especially if you go, we have like a depressive, some kind people will have a depressive type, okay, so they might have experienced so many depressive episodes, that particular people have to go with this type of treatment. Or we can also deal with the people who have bipolar disorder. Okay, example for this bipolar disorder means the very good movie is there in Tamil, that is Onion. The people, the hero will be shown in three different style, right? One is a soft style, one is in Romeo type, another one is like villain type, right? So three different style. The people will like shift to one behavior to next behavior, and then one behavior to another behavior unknowingly. That is the main thing here. Without their consciousness, they are more shifting one type to another type. So this type of problem we can be treated with this ECT. Okay, so here the ECT is it's a type of treatment we can go we can proceed with this, but the thing is we can't go this particular treatment for all the people. There are certain condition to be meet before going to this treatment. That the one thing is that the people should not like 13 years and older. Okay, especially the people with 13 years older with the depression or bipolar disorder, we can go with this type of ECT. And if those people there is no there is no outcome, or the medication also failed for treating this problem in the sense, then we can go with this type of ECT treatment. Okay, that is the main thing. So and one of these following two criteria, okay, either they have a severe or a treatment resistant depression, or they can have rapid response due to life-threatening circumstance. So these are the main two conditions. If any one of the condition is there, that particular people, then we can easily go with ECT treatment. Unless until we should not go for ECT, because that is a more side effects it's being involved, even though it is meant for treating some kind of mental disorder problems. Okay, that is we have to be keep in mind before going with ECT. Okay, so what is the procedure we can undergo this ECT while doing treatment for this ECT in the sense? Here we have to place the electrode at the precise location where you want to give the stimulation, and after placing through the device we will be sending the electric current, okay, through the electrodes to the specific point of the area where you want to give the shock. So after doing this, the people will feel experience a seizure activity that will last for a minute. Okay, so this and the whole procedure will take place for the patient while they are in conscious, that awake state, for 5 to 10 minutes. Okay, so this is the steps. Okay, this is the steps we have to follow immediately. At the same time, we will be visualizing, or we will be monitoring the EEG activity of that particular person. If you see, this is the diagram. Here the person is lying on the bed, and we are giving a stimulus by means of some sort of electrodes. Two pair of electrodes is we are placing, and then recording by means of recording electrode, we are recording the electrical activity also, and we are parallelly we are checking what is the kind of response we are getting for that given stimulus. So in this way, we are either exciting that nerve cells, or inhibiting the activity of the nerve cells. So in this way, we are correcting the normal mental state of that particular person. This is the main motto of this ECT treatment. So, and yes, of course there will be some side effects in this case. So the people may feel headache, the upset of stomach, muscle aches, memory loss, disorientation, or the confusion. They may be cause so these are the different side effects that people may feel when they undergo ECT treatments. So this kind of side effects we can't be like avoided, because when we go with the particular treatment, obviously there will be other side will be there, so that we have to compensate, or that we have to take care by taking some other medicines and so on. So this is all about ECT. In next class we will be discussing the next type of brain stimulation treatment. Okay, thank you, bye.